Hi, my name's Johanna. I'm studying Mental Health Nursing Postgraduate Diploma, the 2-year fast-track course at City University, London. I studied criminology and psychology on my undergraduate course, and that furthered my interest in why people commit crimes due to mental illnesses, and I thought mental health nursing would be the next logical step to go into a caring profession whereby I could further develop my knowledge. City University is close to London, it's close to home, it's really easy to get to, and it's just a great location. My first placement was organised by the university, and it was on an elderly acute ward whereby elderly people were experiencing mental illnesses like psychosis. I then went on to work in an acute assessment ward whereby people came in when they were in crisis or needed to be assessed in order to receive a diagnosis so they could get access to other services. The type of experiences I've done clearly shows the different types of walks of life you'll get in mental health illnesses, the different age groups, the different diagnoses you'll work with. There isn't really a typical day on the course. For one day you might be at university doing practical lessons, and another day you might be learning how to do care plan approaches, which can be applied to what you do on placement, where you have to carry out care plans with patients. There'll be weeks where you're at university and weeks while you're on placement, and even days on placement aren't typical. You could be working with elderly on one day, adults on another, children on another. When I was working with the elderly patients, I worked with one lady who was experiencing anxiety because she didn't know how to pay her bills, and she was nervous of being at home, and she was thinking that she couldn't afford to pay these things. So I sat down with her and I budgeted with her like how much money goes where and where her cards are kept. We then went to the post office and we paid her bills for her or alongside her, and this just shows that mental health nursing isn't just about the physical things, like for example with elderly people, washing them and helping them get up out of bed and things. It's more holistic, so working with their physical and their social needs and their psychological needs. Mental health nursing can be very challenging, and whilst on placement there's a reflective practice whereby you can go each week to discuss your experiences and learn from others. It's co-facilitated by someone from the university or someone who's a link lecturer with the trust, and it's really useful if you're finding it difficult. You can talk about your experiences and work through them. At the university you also get a personal tutor who's very supportive and will help you if you've got any problems with the course or within the placement. Mental health nursing is very inspirational and rewarding because you're helping people from when they're at their very rock bottom all the way up to when they're stable and recovered. I'm in my second year of the course now, and I've been thinking about what I want to do when I've graduated and become a registered mental health nurse. Initially I would like to work in an acute setting, and then in the future go to Australia and travel around the coast working with the nursing agency there. I've also received a lot of support from my fellow students, and I think that's because we're a very close cohort. We go for lunches together, sometimes at St Paul's or sometimes down in Whitechapel along Commercial Road, and I think that just demonstrates the diversity of London and the different experiences that you can have whilst you're in London.